My topic is using WhatsApp and Google Sheets as a low-cost digital care model for type 2 diabetes patient to how to monitor and follow up. So we know India is now the diabetic capital of world, and diabetes is a chronic progressive disorder. So it's not like just write the medicine and send the patient to home. It is required continue monitoring and continue follow up. So what we know that the over 100 million people are affected with diabetes, and people in urban, semi-urban and rural areas, primary care physicians are monitoring them, and they have a huge number of patients there. But the issue is they just write the treatment and patient not come to either follow up or either patient stop the treatment. So continue monitoring is required. So what the challenge I got that there's a irregular follow up, poor treatment adherence is there, and limited manpower and digital infrastructure is there. So what I do, I got an idea. In an era of AI or CGM device or EMR system, what limited amount what can I do? I know that every Indian patient or his family member using WhatsApp, and WhatsApp is easy and accepted, easy to use, and it is a low cost digital solution. So it can fill the care gaps. So why I used, there is no additional cost, there is minimal training is required, and real time data access and tracking is easy in case of WhatsApp. So my primary objective is to evaluate the feasibility and effectiveness of WhatsApp based monitoring, and my secondary objective is to assess the adherence, monitor safety, and improve the lifestyle compliance. So it is a study of 12 weeks, but still I have faced the situation that the patient says कि सर हम 2 टाइम कैसे चेक करेंगे शुगर. Sir, ma'am, actually, I belong to a very small town like Itarsi. It's in people, they are not aware of anything. So I'm just using this WhatsApp watch, nothing, what minimum can I do for less than nothing? So that's why I use WhatsApp, and that's the comparison like what minimum we can do to give the better result. So in this case, as still patient is not agree for check sugar 2 times. So I compare the patient use CGM device. सर उसका क्या cost है? मैं 5500. सर हम 2 बार check कर लेंगे. So I told them to do this test, and in 12 weeks, I do this observation study. I choose the patient of adult with type 2 diabetes mellitus patient who are using smartphone and WhatsApp users, and they are regular OPD patients. So patient was sending daily fasting and post-prandial blood sugar via WhatsApp. My staff entered into a Google Sheets, and weekly review and feedback I was taking how is get the result. So I monitor the fasting sugar, postprandial and weight and lifestyle adherence. So weekly I give a weekly diet advice, exercise motivation and medication adherence reinforcement. So in my clinic I do weekly or bi-weekly yoga and Zumba sessions to aware the patients to do the best. These are some of the pictures of yoga and Zumba sessions in my clinic, and so patient come weekly or bi-weekly and they tell how they monitor their sugar level also. So these are Google Sheets data which I entered for weekly, 3 weekly, 6 weekly and 12 weekly. And what I got, there is a high engagement observed, 80 to 90% regular reporting compliance is there, and improve the patient doctor communication is there. My result is there is nearly 30 to 50 milligram per deciliter improvement in sugar level without much intervention, just monitoring of the sugar level weekly. So mean fasting was improvement at 20 to 30 milligram, and postprandial is 32 milligram, and it is sustained improvement over 12 weeks. And improving the dietary compliance, better physical activity, and mild but consistent weight reductions there over 12 weeks without much intervention. So no severe hypoglycemia is reported, and early detection of abnormal values possible if patient is hyperglycemia or hypoglycemic. So my discussion point is it is digital follow-up, improve the quantity of care without much cost, regular monitoring and increase patient accountability, and simple technology proved effective. So compare with the conventional care. Traditional OPD relies on infrequent visits. As we know, patients are not coming in the very rural areas, patients are not follow-up. They stop the treatment or they don't believe the continuity of treatment. Digital model enables the continuous monitoring and better engagement at minimal cost. It is cost effective, reproducible and suitable for small clinics and primary care. My limitation is a small sample size of 60 patients just to understand what can I do. Short follow-up duration and no control groups. My future scope is, as you said, ma'am, I will integrate with EMR system, AI system and large randomized control trial. So my conclusion is WhatsApp-based digital monitoring is feasible and effective. Improve glycemic control and patient engagement, and a practical solution for resource limited setting. So something is better than nothing. Thank you.